Hey guys, thanks for joining us on YouTube. We're here with 11 Alive medical correspondent Dr. Sujatha Reddy, who is answering some of our questions about coronavirus that you might have. And we've been talking about this for a while now. A lot of people have questions about this, mostly like, what are some of the things that you can do? We talked about hand washing, we talked about sanitizing, social distancing, but what about supplements? What about elderberry, echinacea, apple cider vinegar?
And I think that's actually a really good question because there have been some reports of basically snake oil being sold as a treatment, and there have been reports of actually high-profile people doing this. So, it's really sad because unfortunately, right now, there is no proven scientific treatment or remedy for the coronavirus. It's worth saying that the majority of people are going to have mild symptoms and need really no treatment. And for the people that get critically or seriously ill, they're going to end up probably in a hospital. But there is no medication, there's no data that says echinacea, zinc, any of this is going to help. Having said that, if for you, when you get a cold and you take zinc and you feel better, it's not going to hurt you to try that for the coronavirus. So I think in normal amounts, whatever you normally do, should you get a cough or a cold, can't hurt you. I just can't tell you that it's really proven to be effective.
Okay.
But what we do know is if you do feel ill, rest plenty as much as you can. Keep very hydrated, either with water, fruit juices, sports drinks. And if you have aches and pains, a headache, a fever, over-the-counter medication like Advil, Tylenol, Aleve, what you normally would take, can help you feel better, and that's going to be what you need to do.
What about the symptoms? So we're still in flu season.
Absolutely.
People are getting allergies like myself. So what differentiates, what are the two symptoms that you would say these are COVID-19 symptoms versus flu or allergy symptoms?
Yeah, I think that's a really good point because it's a little bit confusing. And still for most of our public out here in Georgia, if you have cough, cold, runny nose, symptoms like that, it probably is a cold, the flu, or allergies. It's still very rare and limited right now in our state to have COVID-19. But how can you tell the difference? So for allergies, what's going to be different is a person with allergies is going to have an itchy, watery eye, stuffy, runny nose, itchy nose, that scratchy allergy kind of throat. Those are not symptoms we're seeing with COVID-19. For the flu, what you want to look for is muscle aches and body aches. And a lot of people with the flu get this incredible fatigue. That's going to really differentiate the flu. Obviously with the flu, you'll also get a fever, you may get a cough, you may get a runny nose, you may get a sore throat, but the main thing for the influenza virus is going to be the body aches and the muscle aches. And the symptoms we're being told for COVID-19 are fever, cough, and shortness of breath, because this really does seem to be a respiratory type virus. So it's going to make it hard to catch your breath or feel like you can't catch your breath, or you're going to maybe possibly wheeze. That's going to be more symptoms we're seeing with the COVID-19.
Right, and since it takes several days, I mean, we talked about this yesterday, that sometimes it could take up to 5 days, sometimes more to show symptoms. We know that nursing homes are taking precautions. One of the things that they told me yesterday that I thought was interesting was that they were doing on-site screenings. They were limiting visitors, but they were doing on-site screenings for those they were allowing in. And we talked about this yesterday. Is that effective?
Yeah, and unfortunately it may not be because we know this virus can be transmitted before the person shows symptoms. Recent data has told us that symptoms typically appear at about 5 days. But before that, you may not have a fever, you may not have a cough, but you have the virus and you may be able to spread it. So just on-site temperature monitoring, unfortunately, is probably not enough.
So what should they do?
I think at this point, especially for the elderly people and people with other medical conditions that we're talking about, I think limiting visitors, trying to keep, if they come to visit, keep a distance. I think we need to keep our seniors well trained in FaceTime, because that's going to give them some contact. You can check on them, make sure they're okay, but the safest thing is going to be limiting visitors as much as possible.
So how about, I mean, we've seen images on the news of people visiting their loved ones at some of the nursing homes and being separated by a window, and those are just heartbreaking images. Sometimes some of these seniors, as we've talked about in the past few weeks, they don't know what's going on. Some of them have issues such as dementia, Alzheimer's. They don't know what's going on. So how do you deal with, a loved one who doesn't know, doesn't understand the circumstances as to why you can't come in and visit them?
Yeah, I think you just have to be upfront with them and tell them that there's a virus. Like if you had the flu, you wouldn't go visit them, and I think you have to make that same parallel and try to help them understand. But again, I think even though it's heartbreaking to see them visiting through glass, at least they're seeing each other.
Yes.
FaceTime is going to be a very important option at this point to keep in touch with people with keeping that social distancing.
Right.
So as hard as it is, you're doing it for their own good, and I think we just have to keep stressing that, because we are seeing that it's the people over 60, 70, even older than that are being the ones affected by the most serious complications, and they have the highest risk of dying. Again, still, it's a very small percent of people that are going to have serious complications and die with COVID-19, but it is the elderly that are more vulnerable to that.
And we talked about that on-site screening maybe not being efficient because of those symptoms not showing up for days. So if those symptoms aren't showing up, you're still contagious, right? And you could still be spreading that virus and infecting others.
Yes, you can. We know the most contagious is really when the person has symptoms, but we have seen that it can be transmitted before symptoms appear, which is why doing those simple temperature checks may not be enough. And that's where I think self-policing and trying to think to yourself, it may be better if I don't visit my grandma for her sake than
just in case, even if you're not showing symptoms.
Yeah, I think just for now, until we kind of get a better handle and understanding on this, limiting those visitors, restricting that access is going to be the way to protect our elderly.
And it seems like it would be hard to not spread this virus very widely if you don't have symptoms and you're contagious. So how do we contain that?
So I think we're doing all the things that we can do, because you're right, it could be easy to spread this if we're not careful, and this is where we're asking people to monitor their symptoms, wash their hands, keep that social distance. We're not appropriate right now if we're going to do that.
Too close.
We're too close. But where that 6 feet comes from is the idea that this infection is spread through droplets. Someone coughs, sneezes, a little bit of spittle, a little bit of secretion gets on another person, enters their nose, mouth, gets on their hand, and then they touch their nose or mouth, and that's how it's transmitted. So that idea behind the 6 feet is going to be the droplet probably won't make it that far. And so that's why you're safe. And so we're telling people, if you're going to go to the store, try not to get too close to people, do the best you can, but beyond that, it's the hand sanitizer, the hand washing. Today in my office, as I was seeing patients, I asked patients if they were okay with me shaking their hand or not shaking their hand when we greeted each other. And because I wanted to make them comfortable, even though I can promise you I probably washed my hands 60 times today. But we have to appreciate what people are worried about. And so, changing our social behavior is going to be part of this.
So since we're talking about sanitizing and cleaning, let's stay on that topic and ask, what are the sanitation wipes or Germex, Purell, what are the brands? Tell me about that. What should people be using?
So, hand washing is going to be the best. Hand sanitizer is going to be the second best. You want your hand sanitizer to be primarily alcohol, 60%. Most of the commercially available hand sanitizers, if you can find them, are going to be appropriate. As far as what to wipe down surfaces, things that we have in our house right now, the wipes we use or the chemicals you use to clean your bathroom, your kitchen, are going to kill most viruses and bacteria, and that's what we need to have. You don't have it doesn't have to be a brand name Clorox or Lysol wipe, because those are hard to find as well. You can use what you have in your house that you've been cleaning your house with up till now. Luckily, this virus seems to be easily killed with soap, water, products like that, antibacterial. As far as we can tell right now, the routine run-of-the-mill stuff is going to help you.
Okay. And what about the travel restrictions? So, it was announced last night that there are going to be European travel restrictions, meaning foreign nationals will not be able to come to the United States from Europe. But how about traveling to Europe and then coming back? Because U.S. citizens, permanent residents can come in from Europe. So are you expected to be quarantined, for example?
I think that's really going to depend on where you're going and what's happening at the time that you leave and come back. And that's one of the frustrating things, I think, things that people are trying to decide when they're talking about taking trips. I just showed you, I got that alert from the State Department advising against or warning you that travel abroad may be difficult. And the thing is, this is a very fluid situation. So if you're going to a country by chance that doesn't have a big problem with COVID-19 right now, you've got a week vacation there, that can change in that week. And I do think how our country responds is going to change over time. So you may be able to leave okay. When you come back, you may be possibly held at the airport or not allowed to come back. The ramifications are innumerable. We don't know what's going to happen. One thing, we've not seen something like this in modern medicine in our lifetimes. We've not dealt with something like this. So this is all new to a lot of us. The Spanish flu right after World War I killed millions of
Right.
people because, influenza is still deadlier at this point than COVID-19. But really, since then, we've been lucky. And our generation, my professional career, I've not dealt with something like this. So it's hard to tell people what's going to happen because we don't have much experience. So if you're traveling, I understand it's hard and people deserve their vacation. They want to go on vacation. We just don't know what's going to happen while you're there. Are you going to be allowed to come back?
So one of the questions is, if we have, one of the questions that we got in is, since this is a virus, can we treat it like other viruses when it comes to medicine? I mean, you've answered this.
No, I think that's a really good question. We have antiviral medications,
Right.
like people may have heard of Tamiflu for the flu, but antivirals are specific to the virus. Luckily, the pharmaceutical companies are working very diligently to try to find an antiviral medication to this particular COVID-19 virus. But right now, as far as I have read and heard, the medicines we have now for antivirals aren't working yet on this one. So we have to
Right.
figure out where we can go discover a new one, find a combination that may work. So I know that work is being done. But a good point that we talk about with the flu and stuff too, and even when people get colds, antibiotics do not help fight viruses. Antibiotics help bacteria.
And I just got a post-it note from Tiffany saying, a caller asked about boosting your immune system. Can this help with how you deal with the virus? And we talked a little bit about this. But,
Yeah.
but again, those supplements, those vitamins, I mean, I take vitamin C, vitamin D every day. Can that help boosting my immunity system? Could that help protect
so
me?
your immune system, unfortunately, doesn't get boosted overnight. So, this comes up a lot whenever we're in cold and flu season anyway. So the things that can help your immune system are going to be the healthy lifestyle things all of us should try to do anyway. Often it's the New Year's resolutions things that we hear about. So if you don't eat all your fruits and vegetables every day, and most of us don't, a multivitamin may help you. So, but a healthy diet, lots of fruits and vegetables, whole grains, that's going to be good. Adequate sleep is going to be very important for immune system. They recommended for minimum adults is 6 to 7 hours. Try to get that as much as you can. Some people can get more and they need more, but sleep is going to be very important. Being active, being physically fit, having good endurance, so exercise is going to be part of it. Limit alcohol. Don't smoke if you're a smoker, because smoking absolutely zaps your immunity. And then all the things that we talk about, but keeping yourself healthy is going to be key. I think if you are a person that has an underlying medical condition, keeping that under control is going to be key, so that that doesn't complicate the situation either. So if you have high blood pressure, stay on your medicine, keep that control. If you're a diabetic, keeping good control of your blood sugars, can help you fight infections. So keeping a good, healthy lifestyle is really going to be key. As far as supplements, there's not a lot of data out there, but I have friends that swear if they do zinc when they have a cold, it shortens it. Whatever works for you, and it's hasn't hurt you and doesn't seem harmful and it's reasonable, I say do it.
What about, speaking of underlying medical conditions, you just talked about diabetes. So for example, if someone has bronchitis every year or twice a year, is that an underlying medical condition? And should they be worried? Or if they have asthma, talk about that, because I think there are a lot of questions about that.
So if you get an episode of bronchitis every year, that is not a chronic underlying medical condition. So when we use the term underlying medical condition, we're talking about something where someone goes to a doctor and has medication on a standing basis for that condition. So what we're talking about would be something like you mentioned, asthma. That would be an underlying medical condition. People that have asthma often have triggers, they have inhalers or puffers, they may even have daily medication. So that's an underlying chronic medical condition. Other ones, what we've been told with this one are important, are heart disease and high blood pressure. If you happen to have any sort of lung disease, that can be an issue, because this seems to be a respiratory virus, meaning it's affecting the respiratory system, and that's what's causing the complications. So the underlying medical conditions are what we call chronic, things that you've had for a while that you go to the doctor for on a regular basis. Those are underlying medical conditions. People that get a sinus infection once a year or have to take, that's not it, exactly.
That's good to know. So if you don't have an underlying medical condition, should you be going to large gathering and events? Because we've talked about social distancing, and St. Patrick's Day parades have been canceled in several cities. Should you be preparing to continue with your travel plans, or should you?
You know, I think that's going to be made on a case-by-case basis. I think we're seeing a lot of the major large events are being canceled to try to slow the spread and decrease the spread of this virus. So I think if you have plans to, attend a friend's wedding or, a family reunion, you're going to make those plans on a case-by-case basis. I think if you happen to be a person who's vulnerable, you have these medical conditions, you're an older person, I would think the better part of valor would be not to go, because you just don't know what's going to happen. So, if you're a young, healthy person and this is like, something you've been working towards or planning for a very long time, you may take your chances, but again, that's going to be on a case-by-case basis. I think we're going to see, as this does spread, and if it becomes more of an issue in different states, we're already seeing it in some states, they're actually banning gatherings of more than 200, 250 people, which for a lot of people, that's a wedding. So, I mean, it's going to be very interesting as this progresses. But right now, I think it's got to be, unfortunately, on a case-by-case basis. And I think most people understand their bodies and their immune systems. And if you're a person who's gets sick a lot, maybe you don't go. If you're someone who seems to be kind of tough and you don't get colds all the time, maybe you have a better chance. But again, that's going to be on an individual basis.
And we saw this coronavirus testing. They just opened up a drive-through space in Denver, Colorado. Are we expect to see something like that here in Georgia? Do you know?
I'm not aware of that. I think, again, as numbers grow, that may be a way to do it. They are doing that as well in Korea, and I think in Korea it's actually been pretty successful. I don't think we're there yet here in Georgia, but who knows? I think it's really going to depend on what happens with the number of cases that we see.
And we're getting notices just within the last hour about more schools closing.
Right.
We just got it from APS that they will be canceling school Monday. So are we expected to see this throughout the nation? Because we're seeing it here, we're seeing it in other cities, and we know just from seeing what other countries and cities are doing in response to coronavirus, we're seeing that they're shutting down all schools, all school districts. For example, in Madrid, in Spain, we talked about this. Do we expect to see that here?
I mean, I think we are seeing it, right? We're seeing universities doing it. We're seeing the secondary school systems doing it. And the idea is, so, because kids come in contact with other kids and all those kids goes home to their parents. And so you could see that could be a very easy way. You have a concentration of children in a small space. And if we're talking about banning public gatherings, schools are really, if you think about it, it's a public gathering. Yep. So absolutely, I think you're going to start to see that.
And we just have a few minutes left. I think we have 10 minutes left. So I wanted to talk to you about some of the misinformation and disinformation that is online. I mean, we talked about in Iran where they were saying, if you drink alcohol, you'll be able to prevent yourself from getting COVID-19, and people were doing it and dying because they were dying from alcohol poisoning.
Sad, yeah.
So what are some of the things that people should be aware of?
Yeah, I think that's really important. I think, always go to vetted news sources. Obviously, our 11 Alive news page is very good. The CDC, WHO all have very accurate, vetted information. So I think it's very important in a situation like this to get information from places that it's trusted and reliable. I would not Google and look to blogs because that'd be like asking a stranger on the street, right? So I think in a situation like this, and we just talked about it, but I think it's worth reiterating, there are no known treatments or remedies for this at this time. Right now, people are just being treated for the symptoms that they're showing, and the more severe symptoms obviously people are being hospitalized, possibly in intensive care units, watching their breathing because this is a respiratory virus. But there is no known medication, there's no vaccine at this point. They're obviously working on that. So, if something seems too good to be true, it probably is.
How are doctors and nurses, I mean, you work in an office, how are they protecting themselves? Because you're seeing patients every day that you might not know, even if they're not showing any symptoms. We did say that they could be carrying COVID-19 and they could be contagious. How are you protecting yourself?
So it's been an interesting situation, and this is, again, it's new for us too. So we've put up signs and warning things like most physicians have. If you have symptoms or think you're ill, please don't come in, or tell us, we'll get you a mask. I've heard of other doctors' offices, trying to limit, even like people coming with the patient, limiting visits from like pharmaceutical representatives, just trying to limit our exposure. We still want to take care of our patients. Right now, we're normal business as usual, but we're being very cautious. We are cleaning and wiping and sanitizing, but we've always done that. Let's be real. I've always washed my hands probably 50 to 60 times a day, and I'm continuing to do that. But we're just being more vigilant, asking people to self-monitor, and day by day, our hospital is giving us information. But yeah, it's been an interesting time.
So speaking of that, I mean, if you feel like you might have coronavirus, should you be going to the doctor, or should you be calling a number? What should you be doing?
Yeah, that's a great point. And I think right now, one of the concerns that everyone has is not to overrun the emergency rooms. So people that, are having a heart attack, or, have a car accident, or may have severe respiratory problems from COVID-19 can get the care that they need. I think if you're having mild symptoms, do what you would do normally. You'd probably check with your doctor, follow your symptoms, check your fever, make sure you have a thermometer at home and just monitor that. If you have any signs like shortness of breath, you're having trouble breathing, then obviously you should go to an emergency room. If you're worried about having COVID-19, I would then suggest calling your primary care or your urgent care, wherever you might go, and see what they suggest to do. Do they have the ability to test? What would they recommend? And I think it's really, right now, that's the best advice we can give. I think as we get more testing kits available, it may be easier to get tested, but right now I think it is a little bit restricted still.
And how long, if we are able to get more testing kits, how long does it take to test? And will we see a difference in frequency as they become more available, if they do?
Well, and that's been a great question, because how often do we test people, right? If you were negative 1 week, do you run out and get tested again if you get a runny nose? It's very hard to know that answer. We don't have that. It's a very new outbreak. We just don't know how the symptoms may progress at that point. So I think with the testing, anyone that's had a flu test, it's a swab of the throat and the nose. It's done the exact same way. It's a Q-tip. You pick up that sample. What's happening now is it's being done at some local labs, county, state labs, and then for confirmation they're being sent to CDC. I got an email from our hospital saying that eventually commercial labs like Quest and LabCorp are going to be able to do this, which will make it a lot more easy to do, and more tests will be able to be run. But right now, I believe we're still doing it preliminarily at the state or county level, and then confirmation at the CDC.
And that takes days. So.
It may take a day or two, yes.
Right. And we were talking about the difference between a pandemic and an epidemic, and I think it's important for our viewers to know the difference between the two, because I think it is pretty
because it's a term that we've not really had to hear about or use before. So an epidemic is obviously when disease spreads in an area or a region or maybe even a country. A pandemic is when it's spreading around the world, and I think what the WHO, when they called it a pandemic yesterday, I believe, or the day before, when they did that, it was because it had reached a certain amount of countries. It really wasn't a number of cases, because you can have a lot of cases in one country and that's not a pandemic, or even a lot of cases in one continent. That might not be a pandemic. A pandemic is where it's all around the world, and I think we're seeing that. And even in our own country, initially it was 1 or 2 states, and now we're up to 45, so it is spreading.
I know it's hard to tell, but what is the future of this? How long are we going to be experiencing this in our country?
Yeah, I wish I could tell. That's a hard one to answer. We are seeing that, like in Asia, in China and South Korea, the cases are starting to slow down. They're not having as much. So, I think that's a very hopeful sign.
Right.
I think it's just going to depend. But I think all these things that we're doing, the canceling of large gatherings and trying to all be aware, because I really do believe knowledge and information is power. And I think all that we're trying to do will help us. And I know we're going to come out on this on the other side, and I just hope it soon.
Do you think it could take months? Because I know in Spain, for example, they said 4 to 5 months before everything returns to normalcy. Do you think? Yeah,
it could be. We do know viruses like colds and flus have seasonality. They get better in the summer. So we don't know. This one, again, is so new. Virologists just don't know. But there's some that have said that probably in the warmer climates, perhaps it won't spread as quickly. Maybe the virus will be more vulnerable. So let's hope for that, and that's coming real soon here in Georgia. So.
And when do we expect to? Once we start seeing those numbers, it seems to me that we're going to see numbers increase before we see them decrease. Do you think that's?
I absolutely think we're going to see this get worse before it gets better, unfortunately. But I think that's what we've seen. The natural course of this has been. But again, I think we're making all these proactive changes and steps to try to slow this down, hopefully decrease it. So I think everyone's got to do their part. I think that does take some personal responsibility.
Right.
I think we really have to change how we think about going to work if you don't feel good. I think right now that's probably much more accepted, but in the old days we used to try to tell people, people had the idea that they had to go to work to do their job, not to burden their coworkers. But now I think it's about keeping all of us healthy. If you don't feel good, you've been around some people, you've traveled, self-quarantine is going to really help society.
And how much is too much? Because we're seeing a lot of people rushing to the grocery stores, buying up a ton of toilet paper, buying up a ton of supplies. I went to the grocery store and it was bare bones.
Yeah.
So how much is too much?
I think being prepared is very key, but I think panic is counterproductive, and I think we're on the board. It's a very fine line. I think be prepared, have a supply, again, main things, medication, the essentials. If you had to be in your house and no one could come to you or help you with things,
right.
What would you really need? And I think have 2 to 4 weeks of stuff in your home for that, but panicking isn't going to help anybody. I think being prepared, being aware is going to be good, but there is so much panic out there. I think that's going to be counterproductive.
And we just got a question. Danisha just sent me one. How is the test conducted? We talked about this. Is it blood work? Can you explain?
Yeah,
a little
so
more about
it's
that?
done like a flu test, which is a Q-tip that they swab into the nose and in the throat looking for the virus. There are some blood tests available, but that is not the common way they do it. It's commonly done with the swab.
Okay, and is there, another question came in and Dr. Reddy did answer this, is there a vaccine? I know we said it could be up to a year or two before they develop a vaccine.
So the thing
correct?
with why it takes so long for the vaccine is you want to make sure that it's safe. You don't want to make sure it has no complications or side effects because you're giving this vaccine to healthy people. You want to keep them that way. So the vaccine is probably a year away.
A year away. And by then, will it be too late?
No, I hopefully will be over this bout of it, and maybe that vaccine will become what we all get to prevent this from becoming a problem down the road. So I don't think it'll be too late, because once a virus is here, it can reappear.
It can come back. And is there anything else that you think that people have, have people, you've been receiving calls.
Yeah.
Are there any calls that you've been getting that you're like, I wish people knew this one thing about COVID-19?
I think the main thing to really remember, and we keep saying this, is that the majority of people, over 80%, will have mild symptoms and not even need to go to the hospital. It'll run its course very similar to a cold, and then the rare cases are where we're seeing the serious complications. But that is still scary, I understand, because it is so new. But still to this day, if you haven't gotten your flu shot, that's probably your best defense, because still, tens of thousands of people around the world have died from the flu this year. And luckily with COVID-19, we're still in the low thousands. So again, your flu, you're more likely to have complications of the flu than COVID-19. So while it is scary because it is so new and it's out there and we don't know a lot about it, fortunately, it's not as dangerous as some other things that we're dealing with.
I just got another question. Someone asking me, should I be concerned about my pets?
Yes, so far what we've been seeing is that this is not transmittal to or from pets. Pets seem to be okay, which is good, because if you're self-quarantining, your pet may be your only company for a little while. So we want to make sure they're safe and healthy.
And should people be stocking up on, we talked about the toilet paper and stuff. What about food? I know we talked about 2 weeks supply.
Yeah.
What about helping your loved ones who might have underlying medical conditions, who might be elderly, your grandparents? Should you be going out and helping them get their prescriptions filled? Is that something that you should be doing?
Yeah, I think definitely. If you, especially for the elderly, we're recommending people that are more vulnerable sort of avoid crowds, and stores and pharmacies can be like that. They're often sick people in pharmacies. So yes, if you can help someone get their medicines, get their prescriptions, I think that would definitely be a good idea. Help your neighbor if they're older, drop groceries off for them. Yeah, I think having non-perishables in your house is going to make sense. Luckily nowadays we have food delivery systems out there, but really it's better if you have your own stuff. So freezer full of things like frozen vegetables, canned things, even though those are not always healthy, in a limited supply, that would be good. Canned soups, things like that, things that you have. I think having some of those on hand can be handy if you don't want to expose yourself to the grocery store as much as possible. So, but this is, you really raise a good point. It's kind of a community thing. Neighbors can help neighbors. Maybe one person can go to the store to make the grocery run and limit exposure. I think all those kind of things we're going to hopefully see take root, where we're just going to help each other, which I think is important. I did get one question that kind of was going back to something that we said. As far as we know, just because this is a virus, just like other viruses, you should not be able to get it twice. Once you've had it, you should be set.
That's great. That's good to know. All right, well, I think we're done with our questions. Thank you so much, Dr. Reddy. And thank you to our viewers for your questions. If you have any other questions, feel free to post them below, and we'll be answering them throughout the week.
Thank you. Bye.